Good afternoon, everybody. Thank you for being here. It's the second time I've done that recently. I have Dr. Gupta here too as well. She'll touch on some things that she wants to reaffirm with the public. I'm going to go over some data. I'm trying to give as much data as we can in advance of tomorrow's holiday so that our teams who will be working tomorrow can focus in on tracing and whatnot and not data collection. So let's begin. We have 3 new deaths in the community. Certainly I want to let these families know how sorry I am and how sorry we all are as a Onondaga County family for their losses and the timing of their losses. Male in his 90s, female in her 70s, and a resident of a nursing home. So certainly a tough way to start the Thanksgiving holiday. Related to testing, I'm going to give about a 40-hour look back here with cases and testing. So I'm basically giving 2 days worth of data in both of these up through 3 o'clock today. So any new cases today we'll just report out the next day. I'm basically giving you 2 days worth of cases right now. We've had 10,895 tests through today. Our 7-day rolling average, I guess this is the positive for today, is 3.4%. So the positivity rate in the community has gone down this week. That is positive. 116 individuals are now in the hospital with 26 in the ICU. People are getting very sick with this wave with the virus. For those of you, this is a disease that impacts your breathing, but then many cases there's other complications that happen shortly thereafter, blood clotting, poisoning in the blood. How do I know this? Because I talk to families about what's happening and what's going on with their loved ones. So this is stuff. The increased hospitalizations are not anything that we should be surprised about with the increased caseloads that we've had. We've said 5 to 8% of active caseloads is where the hospital trend always is, and that is held true. So the way to get these hospital numbers down is to get these caseloads down. Speaking of the caseloads, we have 495 cases over the last, essentially, I'll say 36 to 40 hours. We've now have 9,679 positive cases. That's over 2% of the population now of Onondaga County. So what we're seeing with cases is the cases have started to flatten. That's somewhat positive. What is still a challenge is at this caseload, this elevated caseload, it's harder to do our regular jobs. We've given, Dr. Gupta and I talked yesterday, we're going to have essentially resources committed to the 200 caseload a day. That's what the caseloads have been essentially every day. That's what last week's average was. When you look at this week, it looks like that's what the average is going to probably average out to be, which would mean our caseloads have flattened. That's positive. The positivity rate's going down. Those are the positives. The negatives are with caseloads this high, you're going to have a lot of sick people, and certainly it's going to put pressure on mortality rates like we've seen today. When we look at testing in the community, symptomatic testing capacity will be increased next week as some of our testing partners' demands with colleges are going away, so we'll increase symptomatic testing. The same test sites will be there. We'll just be able to do more tests per day. We'll talk about those next week, but that should dramatically increase for folks when they want to get an appointment quicker. That should happen. Again, your saliva test with Upstate at the FSHAD, mychart.upstate.edu. You register online, and with Cayuga Medical, anyone who has symptoms at the FSHAD, ongov.net/Cayuga Medical. That's where we'll be increasing capacity moving forward. So that's good. So if you're sick, you're trying to go to various sites for a test, there will be more slots available next week. Asymptomatic testing. Those of you who are reporting see it done here. We're doing quite a bit of it. We're now doing asymptomatic testing at the On-Center. Again, to register, covid19.ongov.net. If you have symptoms, coming here doesn't work. You're going to have to go get a regular test. So if you're sick, you got to go to another site. This is for asymptomatic testing only because of the type of test that we're doing here. Doesn't work for symptomatic patients. So again, go and register there. Yellow zone testing, and we'll get into orange zone testing in a second. But yellow zone testing, I think we have a map. Do we have a map of the yellow zone testing? Yes. So that's the map of the yellow zone and the orange zone. All the dots on that map represent schools. So it shows the challenge that we have in order to keep students going for in-person learning. And we've essentially gone all in on keeping kids in school for many, many reasons. One, we know it's safe. The rate of transmission or the positivity rate in schools is much less than the community at large. There's been little to no evidence of cases being transmitted within the buildings. That is because it's a controlled environment. People are wearing proper PPE. You have social distancing, mask wearing, hand sanitizing going on. So at this point, school is proven to be very safe. We also know with many of our kids, they're already behind from this process. So keeping kids in school is going to be beneficial to the child and their learning. In addition to that, many of these children, the only meals we know they get a day are in the school buildings. We know that. And so that's critical. And then the continuity of care needs to be highlighted as well. Part of our major concerns with the first wave of this was we have had kids home, our mandatory reporters about abuse and neglect, who are our front lines, are our teachers and our educators, and these kids weren't with them for so long. So we had real concerns about what happens with the safety of the child at home. So for all of these reasons, the nutrition, the continuity of care, the best of the child, we have dedicated an amazing amount of resources to get the testing done. This week we'll go through our yellow zone, first yellow zone schools, assuming the positivity rate is good. They are graduated out of the testing protocols. Our second yellow zone schools that have now come in to the yellow zone will begin testing. Our teams are working on those schedules. And for the districts related to the orange zone, this is the first, these are the first schools that went from a yellow to an orange zone in the state. So we're kind of working with the state now on how to make everybody comfortable. We have suggested, the mayor and I talked to the state today, we suggested that they allow everybody to report on Monday, and then by Friday we will have tested everybody. And so that first regulation right now is you got to test everybody to get going. That makes sense if you think about it. If you go right into an orange zone, you go right orange, you have to make sure it is a safe place, so you test the kids going in. We've already been in a yellow zone with these schools. We already got the data. We know that the positivity rate, I think, was 0.5 or 0.6 for the city school district, over 3,000 tests done. So we already have a lot of data. We already know it's a safe place. So that's what our ask was. If the state is not comfortable with that, what we will do with the Syracuse City School District is we will open up 8 buildings a day starting Monday. And we've talked to Superintendent Elisea, and we'll work with him on what 8 buildings are opening up per day. But that's what we'll do if we don't get the request granted from New York State. Lincourt School District, I believe we're going to open up on Monday. Smaller district, we'll be able to test everybody. So that goes to yellow and orange zone. Let me give you this. For the yellow zone testing, since we started this, 7,300 tests of staff and students, 8 days, 30 positives, 0.4% positivity rate. So it has turned out to be a good exercise from the standpoint of affirming what we believed, that schools are safe for the kids and the faculty, but also those are 30 cases we probably would have gotten to at some point, but we got to them faster. That allows us to box in the virus and get ahead of it. Other asymptomatic zip code testing we started as well. We did yesterday, we did 13204 and 13208. Today we did 13104, 13066, that's in Manlius. And then we did 13039 out in Cicero, North Syracuse. My numbers are 457 tests, 6 positives. Out of that, I think it's a 1.3% positivity rate in those two. Then here at the On Center, I don't know what's happened in the last hour, but we had 334 tests, 1 positive, 0.3. So overall, with our asymptomatic testing for the day, before I got here, 791 tests with 7 positives, so 0.89. Again, this gives us a better sense when we're looking at zip code data to make determinations on essentially economic reopenings. We want to solidify the data. So the positive rates have basically been driven by sick people getting tested. Now we're going in, we see where those rates are. We're going in and testing those zip codes with asymptomatic testing to get a whole picture. And some of the picture may say that those positive rates were artificially high, and in those areas the problem is not as big, and then they can transition after testing that from orange back to yellow or yellow to nothing. But there may be problems in those areas, even when you include the asymptomatic testing, and then you kind of re-strategize and look at it a little bit closer. So that's where that is. Orange zones, it starts today for businesses. I know this is painful. I've spoken to many people. We are speaking with the state where we think the data shows some flaws in the strategy, and have offered up some ideas on how maybe we can amend some of the guidance and look at regulations as a way to maybe loosen up some guidance for these business owners. Certainly, I feel for everybody right now, and I know how scared all these business owners and employees are. And we want everybody to be open and operating where we can do it safely. So those are discussions that we're having, and I understand the anxiety. I feel the anxiety with you. At this point, I want to have Dr. Gupta come up and just reaffirm some of the processes. We're getting a lot of questions. There's a lot of activity. There's a lot of information. It's all happening so fast. So, reminding people on what an isolation means, what a quarantine means, and really highlighting some of that. So, Doctor, why don't you come on up?
Thank you. Good afternoon. What I wanted to come and pretty much take it from where County Executive has emphasized that how much more we are seeing the surge in cases and numbers. With that, the work of the health department continues to expand significantly. There are certain things which we are seeing. There are more testing, if there's more testing available, but at the same time there are delays in the testing results we are seeing. So, and we are getting not like in 24 hours. It was at one point quite well. Now it can be few days to pretty much 7 to 10 days in some situation. So my primary ask at this point is for anyone who is considering testing or has gone for testing because of their own concern, whether for exposure or for they have symptoms, they really should consider themselves a positive. If they have symptoms, especially, that's one of those things I would ask them. It means that if you really suspect you may have COVID positive, and also if you have not heard from health department because health department has not received your result, one, you can call If you have the result, you can upload at our portal, which we have that information also. Or if you don't have the results, you're waiting for it, you have all symptoms suggesting, please isolate yourself. Please isolate yourself. We have a high infection rate at this point. It means we are going to see more people positive. And what we would ask everybody to do, make sure you inform your contacts, which is important, your loved ones who you may have seen. If you have attended some sort of event, a small gathering, please contact them and tell them that you should consider yourself in a self-quarantining and monitor your symptoms. Once we get the results, of course, then we do that investigation. But in the lack of it, when we don't have information, we don't want people to get paralyzed because they do have those tools. They can take care of themselves. It means they certainly should follow all the guidance for the guidelines for the isolation and quarantine. The other issue I wanted to make sure is that schools. So when we are working with the schools in terms of isolation and quarantine, when we have a student or a child or a staff is positive, we work with the school superintendents, their staff, to find where the path of this staff or the child has been. It means our schools are very strong partner in contact tracing, and they sort of are our extension. And when we have given them tools to how to identify, how to follow our guidelines, that who should be in quarantine based on state, CDC, and our guidelines. It's all combo, essentially. We follow CDC and state, and they have that toolkit they can actually follow, and that's how they give us all the information. So they are going to continue to support our work, and when they are sending that information to the parent or the staff, I would ask to those parents and staff, please think your quarantine started that day you got the letter from the superintendent. That is so crucial. We will contact them as soon as we can because our information has to be into the system. They will be officially contacted, but we don't want any dead space, no time in between left, that people feel like, oh, we didn't get information from nobody contacted us. Yes, the school is our extension at this point, so we are urging everyone, if you get a letter, if you get a call from the school principal or superintendent, and then they are conveying that to you that your child or as a teacher or staff, you are going to be in quarantine, please start that day. It is an official order in a way without the official record there. So I'm sending them a sample quarantine order, that how they are going to send it out, and they will share with everybody, whoever is going to be quarantined. It is very important because they do feel sometimes people push back, and I promise them I will make sure that I convey that back to them. And that order is actually is posted at our website. If you go to the COVID webpage, it's sort of a sample isolation and quarantine order. They are not going to send the isolation order. Isolation orders falls onto us because we are doing investigation. Quarantine is the one which they are going to send as a sample order and then say, this is what you are going to get from health department. That means if we are sending you a letter, your quarantine starts. So I'm urging all the parents, all the staff to please follow, because health of the community, health of your school is literally in your hands. And that's my biggest ask as we go into the Thanksgiving and further holidays. So these are my couple of things I just wanted to remind. Thank you.
Thanks, Dr. Gupta. And another thing just related to small businesses and something that I think would be good for all of us as a community to support. I had a call with our restaurant association today, and certainly these folks are going to be impacted. And what's different from the second round of this, the second wave and the first wave, in the first wave, if you recall, the federal government and the state government put in mandates for shutdowns. But when they put in those mandates, they gave businesses loans that turned into grants. They had unemployment for the folks that were losing their jobs in place. This isn't the case this time. So you need to, we need to massage this differently than what we did in the first round. You can't just shut things down the way they did without these precautions, or else you have other huge public health driven issues that happen and other serious issues that happen. So one of the things, what can we do locally? And this is the time of the holiday season. I'm highly encouraging people to buy gift cards from local businesses for folks for the holidays, whether it's something you're doing for Thanksgiving or for the holiday season coming up in December. This is a way where you can put money into small businesses, into their checkbooks right now, and then you can get the takeout, or you can get the takeout down the road. But this is something that I'm highly encouraging us to do to support the small businesses that are going to be impacted, because they're getting impacted now. And this will help us make sure that when we get through this, that these businesses are there for us on the back end of this. Saying that, happy to take some questions.
A list or a spreadsheet, I guess, of the businesses of various different kinds, bars, restaurants, gyms, that the county has actually warned or gone ahead and actually cited with some pretty hefty fines. And for people who didn't see the list like us, can you talk about that process of how those businesses, why they were fined, you know, how inspectors go in?
Sure.
And obviously that shows that you're very serious if about 90 businesses of some type have been fined by the county.
So we set up essentially hotlines, or whether it's our economic development office where you can put a complaint in. My office gets complaints. Dr. Gupta's office gets complaints. We then, this is a complaint-driven process, but also what we then look at is, and what we started before Halloween, is we're looking at the information that Dr. Gupta is giving us. And we're looking at where the positive cases are coming from, and then from the contact tracing investigations, what do we learn from those? And are we learning that one segment of the economy is driving a lot of these cases? And what we learned is that, and it's not a surprise, right? It's what everybody's suggested would happen. It's just everything started to move indoors, where outdoors and during the summertime we really did a great job starving the virus. Is that areas or businesses where people are gathering have more risk. And then when people are gathering and maybe consuming alcohol, there's even more risk. So the data showed us that. So then we go and we enforce. Complaint-driven, when you think about big box, retail, mask wearing is usually the complaint. We're more, so we enforce that way, and then we enforce to make sure that businesses who have attested, again, this isn't us picking on businesses, right? These are companies that attested, essentially signed a contract with New York State that they were going to follow the rules. So when we go out and inspect, most of the businesses were following the rules, but some were not. And so you get warned. Most of these businesses got warned a couple times, but as you know what you say in baseball, 3 strikes you're out, and that's what essentially happened with many of these companies.
Ryan, was there a reason why this past weekend it was so many convenience stores?
Yeah, so when what happened is you go into yellow zone, the state brings in some resources for enforcement. So our number one goal is to always make sure that where public health cases are being driven from, that's where we enforce first. Essentially, SLA came in and was enforcing those businesses, so we were able to go to our complaint-driven system with the other types of businesses, and that's how that happened.
One industry missing from that spreadsheet are hair salons and nail salons, the personal care that's included in the orange zone restrictions. Where does the conversation stand with the state that Mayor Walsh alluded to on Monday about removing that industry from the orange zone restrictions?
Yeah, so we're having these conversations, and again, if you think about how we did restart, the zones are kind of almost like going backwards on restart. So it doesn't surprise me that some of these industries that got opened later are first to come off. But now what's changed is everything in the restart was based off of not so much scientific data because we hadn't been through this, right? And so now we have more data. We have had a type of case in everything there is, right? So has there been a case in a nail salon? Sure. There's been 9,600 cases. There's been a case everywhere. There's been every company, every organization, including ours, has had cases. So you got to look for real drivers of cases and real trends. And some of these small businesses haven't been drivers of cases. And where you have seen drivers, you've seen us have no problem enforcing and fining and not complaining so much about regulations that happen there. I think gyms is tough. I have emails from the same people who are treating our sick in the hospitals saying, I can't even get a workout in now. And they're dealing with some high stress level things. So we've come up with some concepts to the state that I do believe they are considering. I do. There's been times where we've had concepts and I don't think they were considering. I do believe some of the things we talked about they are considering.
What are the concepts?
I'm not going to get too much into it, Andrew. I don't want to
Could you
box
just
anybody
explain
in.
a little more?
We can treat some of these businesses are again easier to regulate than others, and the ones that are easier to regulate, if we're worried about people transmitting the virus in those facilities, you can look at different testing protocols similar to what we've done with schools.
I haven't spoken to Monroe County, but a reporter today asked the governor in Rochester about hair salons. She says their health department has contract traced 0 cases at hair salons. I'm wondering if in Onondaga County and the health commissioners here, if we can say right now that there has been a case attached to a hair salon or not.
I'm sure there has been. There's been 9,600.
But not in Monroe County.
Look, they got more cases than us too, so that would be, they have about 50% more cases than we do. But there's been a case everywhere. That doesn't mean it's a problem, right? So I think that's the issue, is when you put regulations on, you shouldn't just put a regulation on because you want to act like you're putting a regulation, right? Where are the cases happening? Now, some of these, and I think the challenge is for New York, right? So New York, it's such a diverse state. Everything is so different. So where some of these regulations may work in New York City or Rockland or Orange, which saw the first problems, they don't maybe work as well here. And I think part of the reason why we haven't seen the cases in gyms is there are some people who aren't just going to the gym anymore, right? They're still nervous about that. So your density is thinner anyways. So I think there's ways we can tweak this to limit some of the economic hardship on these business owners and still do it in a safe way. And those are the conversations we want to have.
Ryan, there's still plenty up in the air about schools, I guess, coming Monday. So when will parents in Syracuse and other orange zones know? Is there a deadline by which they can plan on whether schools are going to be open Monday or not?
Yeah, so we're going to let so we're really talking about the city school district that has an impact. So what we can do if the state, we hope to hear from the state today on our conversation. If they come back and they say, we're not ready, we're not comfortable, whatever it is, then what we will start to do is implement a schedule where Monday, 8 schools in the city will open. Tuesday, the next 8. Wednesday, the next 8. What those schools are, that's going to be the superintendent's call, not our call. So I think that communication will probably happen later today. And then if we hear on Friday from the state that, guess what? Everybody can come back Monday. You just got to have everybody tested by Friday, which was our proposal. Then I'm sure the superintendent will pivot and get everybody back.
If they don't let all the schools open, why would they let 8?
Because we'll test every kid. We can only test
as they come in?
Correct. We will have the teams ready. We can do 8 schools to test every kid under the orange guidance.
Ryan, can you talk about the school districts that are in the yellow zone, the new districts that are in that yellow zone? What's the timeline for beginning that testing?
So that testing, Dan, what, are we starting at the end of the week, midweek? What are we doing for? Yeah, so the new school's at 2 weeks to accomplish the 25% yellow zone testing. So we'll blend in, our focus will be get the existing yellow schools out of the testing, right? Get through, make sure the numbers match up to where they are so that next week we don't have to do that testing. Get the orange schools up and running. Again, if we get flexibility from the state on that, we'll be able to do that quickly. But then between the next week then would probably be a heavy focus in on, I think, Fayetteville Manlius schools, Janesville DeWitt schools, West Genesee schools. I'm not sure if OCS has schools. A little bit of Onondaga's in there. Cicero North Syracuse has more schools now. Other schools are already in it. So these districts that are new will either work their way into the cycle next week, but if not next week, the following week, we'll get to all of them.
Do parents need to give permission still for a
They
student
do.
to be tested? So what does that process look like if you're testing morning of going to school?
Well, I think they're going to work that out. The superintendent's got to work that out with his parents, right? That's the rule as of right now. So I've been pleasantly surprised is that parents want their kids, we thought we'd get some pushback, but I haven't heard of any. So most parents want their kids in school. And these are for the in-person learners, right? These aren't for, we don't need to test kids who aren't in person. So they already committed in person. They could have committed to a hybrid or a remote learning. They want them in school, so of course they're going to let them get tested. Now the fear of the test isn't there. This is not the full nasal swab. So it's a lot. Look at the map. It's a lot. We want kids in school.
The parents will also have to be prepared to come get their kid if they test positive.
Correct. We will do
Don't test at all.
with a positive test. We will handle it like we do any other positive test. We'll take that kid and put them in an isolation situation, and then work with them.
Or what if they show up to school without permission to be tested?
Those logistics have to be worked out with the superintendent. We're not going to worry about that. They got to worry about
But
that.
state rule is if the student is not tested and test negative, not allowed in the building.
Correct. Correct.
Back to businesses, what's your enforcement message as we really start into the kickoff of the holiday retail shopping season? Obviously, once I've seen that list now. Not everybody in Onondaga County has seen that list. Not every business owner has seen that list. But there are, there's real teeth behind, your message to do the right thing and enforce things as a business owner.
Yeah, this is a contract, right? So we all worked very, very hard to make sure that we got our economy open, almost 100%, not 100%, but we there. Now the virus has reemerged. So the decisions that are made by everybody in the community will have an impact on is this a short period of time where we have economic restrictions, or is this an extended period of time? And that includes the businesses. And so they sign a contract, and you don't sign a contract unless you agree to what's in the terms of the contract, right? So we expect now more than ever that they will be our teammates and our eyes and ears in their facility. So when you think about things like Black Friday, everybody agreed to certain protocols and obviously certain capacity. So we need them to be our teammates, because if you are, we're not going to have problems about going to new zones. We'll have a chance to implement plans to test the positive rates that the state has put out. If you don't give us time to test the positive rates with more testing, then we won't ever get out. So that's where this is, right? So we need to, as a community, the business community needs to do the right things. We need to do the right things. Everybody's got big decisions to make the next 48 hours here. Dr. Gupta is very concerned about what's going to happen. We've heard from the governor predicting very, very large spikes. We've heard from others who are predicting large spikes. I'm going to be the optimist in the room, and I'm going to predict that we are going to respond well and modify the decisions that we're making for tomorrow. I modified my decision even further. I was going from all the McMahon's, right? There's lots of us. The governor says 10 people. We're very angry at first, but we understand why. Then I went to Ryan McMahon family and Tom McMahon family. Now I call Tom McMahon and say, Tom, I'm not even going over to see you tomorrow. It's going to be my family. So everybody, if we all modify these plans, we're all doing a little bit, right? We don't need to cancel plans, but to modify it. We don't know who's got this and who's been exposed to this.
In the southern tier, in Chemung County specifically, they've been for several weeks now, kind of in the yellow and the orange zones, depending on where you look. One of my colleagues, Olivia Dance, obviously you know, she spoke with a Chemung County executive who was worried about, once being in those zones, his neighbors going to other places like Syracuse and Rochester to find businesses, dining options, and therefore spreading possibly the virus. What do you say about that theory? And, are you worried about that happening here?
Yeah, travel, we've gotten travel cases throughout. In my unscientific opinion, how this resurgence started was with more travel cases, and then you had the shift indoors, which then you had symptomatic spread with people going out and to work. But travel, no matter, when we say travel, it's not just all travel related to other states. Most of it every day is actually from other parts of New York. So that is not, County Executive Chris Moss is a smart guy, and he's not wrong that there's risk with all of this, and certain parts of the state have higher positivity rates than others, and so that's the reality. That's why we tell people when you're out and about, we're not saying you can't go out and about, but we're just saying you need to be very cognizant of your own health and the situations you're in, because there's higher positive rates throughout New York and the country, and you should watch your symptoms, and certainly when you're out and about, when you get home, make sure you hit that hand sanitizer. It's 2 days worth of data, so no, it's too tough for us to actually, the timing of it, the came in differently, so you might have had 240 or 250 and then 220 or whatnot. We told Dr. Gupta yesterday that give us 2 days worth of data dumped in, so I'm not sure the specifics of it. Correct. So we're basically reporting out what we normally would report tomorrow today. It would depend on the schools that the superintendent picked, but we have essentially 8 teams that we can put in those buildings, and then we would test all the way through the day with each of those teams. We'll work through the logistics, Mike, and I'm not quite sure how they would do that, or I'll let our EM team talk about what that might look like. Certainly, we think a better protocol would be let the kids in the building, and we'll call them by classroom like we do now. And I think that's the best way to do this. Just like if we have a kid who tests positive now in what we're doing, the kid leaves the building. We isolate the child and call the guardian, and then the child leaves. So we know from the data that we're going to have very few positives in the building. So we would probably go with a route where we're letting the kids go into the classrooms and calling them down more of an organized way. Very difficult to grab them right off the bus and say, test here. We don't know who they are, what classroom, whatnot. So I'm going out on the limb, but I'm thinking we would probably test the way that we have been testing. Yeah, so I think I think the best way to think about this is that we're reaffirming that, and this is a mitigation tool to keep schools safe. Is there a higher percentage rate out in the community? Yes, and that's kind of what we're doing with our other testing. If we didn't have to do school testing, could we go out and do more in the community? Yes. But what I think's going on here, and you look at other communities, like Toronto, I think was one community that just essentially went to a lockdown for everything but schools. Everybody's going to school still, right? Everybody's recognized that this is a controlled environment, and there's so many other factors that we can't have that are so bad for our children. We got to keep this going. This is a proactive way to make sure that we're finding any hidden pocket. Remember, these cases we're finding are asymptomatic cases. The symptomatic kids, many of them aren't sick with COVID, but they are already out of school getting tested at a different site. So we're finding these hidden pockets, which will preserve and make school a safe place moving forward. Now, we really want to test out all these yellow schools over the next 2-3 weeks, so that we don't have to do that anymore, so we can then take that testing infrastructure into the community and do more of that.
I have to be dense, but can you explain the 495 again? You announced 175 at 3 o'clock yesterday. Now it's 3 o'clock, and you're saying...
Yeah, so every day, so Tim, what we normally do, so we're usually reporting data from 24 hours before what the state reports, because the state gets tests into a system. They go and put it out. And then we then get the test faxed to us or through our contact tracing system. And then we then have to go through, look at the lab. This person actually is in Oneida County. We're pushing them there. We have an out of jurisdiction coming in to come here. This comes here. So we basically have to qualify all the numbers. It takes time to do that. So our numbers are always a little different from the state, what they report. So what we did today is I'm giving you the report I would give you tomorrow, today. So I'm doing 2 days worth of reporting. I'm doing yesterday's report, and the report I would give tomorrow, I'm giving it you to today. I will still report out via my social media the hospitalization numbers and any death numbers, and if our 225 it was 225 through today. If something changes with that number, I will also report out a change. There could be more cases. There could be a couple cases we transfer out.
Is there, if this were a normal day, is there a number that you'd be reporting?
Yeah, probably 265, 270, somewhere around there. Yeah.
So that's a record.
What?
That's a record high.
Yeah, I think it's, yeah. I mean, we did 11,000 tests, so it's actually, it's the good news, positive rate better. The bad news is we've got a lot of work to do, right? So that's, the case loads are too high. The case loads, positively wise, have flattened. They've flattened too high, right? Now we have to bend it. So, yeah, the one day, if you look at it from a caseload, yes.
Infection rate is?
3.4.
What time did the orange zone go into effect? Was it midnight?
Yes.
Okay. And that was for businesses and schools, or were those, schools are irrelevant because they're closed
Right.
today? Okay.
Right.
And will there be any testing tomorrow on the holiday?
I don't believe, are we doing on-center testing tomorrow, Dan? No, we're doing Friday. Friday, Saturday, Sunday. Do you know if there's symptomatic testing going on tomorrow at the F-Shed? No? No, at the F-Shed? I don't know if the Syracuse Community Health Center is. I know the hospitals do testing 7 days a week.
Ryan, can you talk about where your partners in your head are at leading into the holiday? You reported, you started out the press conference doing 3 weekends. What's your message to the community on that? Where's your message?
Yeah, so I think overall I try to find the balance with everything and communicate the reality of the situation, and then look for the silver lining. I just think people react different, tend to react better sometimes when you give them something to try to achieve than just be very harsh at times. And sometimes I've been very harsh, right? I think with what we need to say is, though I get these emails from people, and some of these emails are just ridiculous at this point. There's no, the same people that were saying in the beginning, it's not about the cases with restrictions, it's about the hospital numbers, right? So it's about the medical infrastructure, which is a good argument to make, right? That's a good argument to make, that somebody can make. Cases don't matter, it's the hospitals, it's being able to treat the sick. We are strained with that now. This is the highest it has been. So your argument that this isn't a big deal is disqualified, in my opinion. So I get frustrated with that mindset. I do, on the balance side of it, think we need to be surgical with the restrictions we do put on small businesses and companies overall. But the only way we're going to get the hospital numbers down in the next 90 or 120 days before a vaccine starts to really be distributed in a meaningful way, and it might even be a little bit longer than that, but it will start being distributed, but surgically, and then hopefully in the spring in a meaningful way, is we got to change our behavior. Caseloads have been flattened, but they're flattened too high. So we have to bend the curve and make up ground. And if we do that, the hospital numbers will go down. But I've spoken to family members of people that have reached out to me who their loved ones got sick on a Sunday and they're in an ICU bed on a Tuesday. And it happens that fast. And so it's tough for me to get some of the input I get when I can see that side of it. In my job, I have the benefit of seeing all sides of it, I guess, and feeling all sides of it. So what we need the community to do now is we need the community to rally. We can live with this virus if we are smart and do the things we need to do to get us through to the vaccine. If we do not do those things, and we want to continue to have large gatherings where we know it spreads, as fun as it is, we know it spreads, the data will not get better, and then the government that has the ability to put more restrictions on will. That's what's going to happen. So I think we can do better. I think we will do better. And then that will mean that less people will get sick and less people will die. And then by the time we get through, hopefully a light winter, we'll get lots of vaccines distributed out to lots of people. And then in 2021, at some point, we'll get our lives back. In the beginning of this, we didn't know that. We didn't know if this was going to be a one-year deal, a two-year deal, a three-year deal. We didn't know that. Now we do know. So there's hope there. We just need people to respond.
Your message has been very consistent at that level of urgency, probably since Halloween. What aren't people getting still? I mean, there was a record 24-hour number of cases. That what you're saying there, people either, I think fatigue in some ways has to have been stopped by you by now over the last month. People can't be fatigued anymore. They either don't buy it anymore, they refuse to follow it. I mean, I'm just wondering what your frustration level is. You've said the same thing over and over again. I've sat here and heard it over and over again. What aren't people getting?
Some people, I think COVID fatigue was there, and I think there's, I don't know what the word is after COVID fatigue, but where it really impacts the way you just view this situation. I think that exists. And we always get a big number on a Wednesday, right? It's just the way that the whole thing goes. So you increase your testing, you're going to get more. So the 265 or 270, that doesn't freak me out compared to whatever the number was before, because we always know Wednesdays are our big numbers. I'm looking for what tomorrow, Friday, Saturday, Sunday will be to see if we really flatten the caseload. The positive rate's going down a little bit, but can we sustain that? But really what the big deal is my frustration 2 weeks from now, if nobody changes and Dr. Gupta's team's tracing 400 cases a day from Thanksgiving, then it's a different story, right? Then people knew, people decided they knew better than what the science and the data is telling you, and they were wrong, right? So overall, again, I'm going to be an optimist going into this situation. I think people are modifying their plans. Part of this is just the damage of the virus that's already been done. These people didn't get these cases yesterday or the day before. They got them. They were exposed probably 10 days ago, 2 weeks ago. And that's just the cycle of this. So the next few weeks will show how serious the community has been responding.
The governor seemed very dismissive of any flexibility of letting hair salons and some other industries get out of this restrictions with the orange zone in his briefing today. How confident are you in your discussions with the state that there's any wiggle room?
I don't know. Again, I feel they are listening. So I didn't see the governor's briefing today. So I'm not sure what he said or how he said it.
You have businesses really crushed, more than ever it seems, because they were allowed to do it well. Most have, and they're still told they
So
can't.
the way out of an orange zone where the governor or anybody can't deny it is a positive rate, right? So if the rate is 5, and then after 10 days the rate is 2.5, that's probably a good argument to get out of an orange zone. So part of the rallying cry of the community is all these business owners that are being hurt. We can help. We're part of the answer, and we're part of the solution. And if we can do that, these businesses will get their livelihoods back, and your gym, your favorite gym, you'll be able to get a workout in too. In the meantime, do I think some of these businesses have been stereotyped to be super spreaders? Yes, I think they have been, and I don't think that's proven out to be the case. But the reality is the best way that everybody can agree is to get the data going in the right direction. Socially distance, physically distance. Obviously, wearing a mask isn't a pretty good idea these days. In addition to that, it's what we do when we're outside of our houses that's going to drive this. Well, just how serious and how fast. I've talked to people and recently. This isn't wave 1. This is what we're dealing with now. They are, you talk to these folks and that's what they say. It just happens so fast and nobody's prepared. And in many cases they don't even know how. They just don't have any answers, and it's very hard for these people. So that's the reality. We're seeing people in the hospital, all ages, right? This isn't just impacting nursing home residents who go into the hospital. There's a lot of people who are very healthy who are getting sick. So we need to respect the virus, and if we respect it again the way we did in the beginning, we're going to get through this.
And then 10 days from tomorrow, from Thanksgiving, is Saturday, December 5th, I think. What kind of modeling has been done to see what could potentially happen either way, and how concerned are you?
Yeah, I think you could. There's various models of various factors where things could get pretty ugly. You could see 2 to 3 times the cases if people don't respond, or you could see this continuing to flatten. I think for us to know if we're effective with the last 2 to 3 weeks will really be the data that comes out the rest of the week. We'll be able to say we averaged 200 cases a week last week. We did more testing this week. Week over week growth was about 9% from the week before, where it was 90% growth from the week before. So we dropped 81%. If we can get to flat this next week compared to last week's, and the positive rate continues to go down, that means we made progress. So then are we going to give up that progress? And that's what the next 48 hours will determine. Yeah, and if you get to that level, the zones, we're all in an orange zone, right? If you get to those levels. So you don't like orange, if we get to that level, we're all orange. We might be worse if you get to that level. So I think there is incentives here for us to respect this virus, even if we don't want to. Anything else? Listen, everybody have a happy Thanksgiving. It's been a tough year. We do have a lot to be thankful for, and we need to do it differently. We need to be safe.